Welcome to this explainer. Turning 65 is a pretty massive milestone. It brings up all these great things like retirement dreams, senior discounts, and, well, a literal mountain of incredibly confusing junk mail and government paperwork, right? If you're currently staring down your mailbox, kind of wondering if you need a law degree just to understand your Medicare brochures, let me tell you, you are in exactly the right place. Today, we're taking all the guesswork out of the equation. We are going to take that pile of confusing paperwork and transform it into a clear, structured roadmap. By the end of our time together today, you're going to know exactly when you need to act and precisely what your options are.
Okay, let's dive into the agenda for this explainer. First, welcome to Medicare. Then, your initial enrollment window, the two main paths, how original Medicare works, how Medicare Advantage works, and finally, making your final choice.
Welcome to Medicare, the milestone.
Qualifying for Medicare is a huge deal, and it all anchors around one magic number, 65. For the vast majority of Americans, this is the exact age when you first become eligible for this massive government program. For decades, you've probably had your health insurance chosen for you by an employer, or maybe you navigated the private marketplace on your own. But now you're stepping into a comprehensive national system. It's an exciting transition, but here is the critical thing you have to understand. Medicare doesn't just magically activate and take care of everything on your 65th birthday without you having to lift a finger. You actually have to take action, and the timing of that action, it is strictly enforced.
Moving on to Section 2, your initial enrollment window and when you must act.
Seriously, if you take away only one single thing from this explainer, let it be this. Missing your window can literally result in permanent late enrollment penalties added to your monthly premiums for the rest of your life. So I want you to remember the rule of 7. When you are newly eligible for Medicare because you're turning 65, you have a critical 7-month window to sign up for your initial coverage. Notice it's not just the month of your birthday, it's a carefully defined period, and understanding how it works gives you total control over when your coverage actually kicks in. So here is how that 7-month window breaks down in practical terms. Your window opens exactly 3 months before the month you turn 65, then you have your birthday month itself, and finally the window closes 3 months after the month you turn 65. So why does this specific timeline matter so much? Well, if you want your Medicare coverage to start on the very first day of the month you turn 65, you absolutely must sign up during those first 3 months before your birthday. If you wait until your birthday month or those 3 months after, your coverage is going to be delayed. It'll start the first day of the month after the plan actually gets your request. Bottom line, being proactive literally gets you covered faster. Before we move on to the plans themselves, I want to briefly clarify the timeline for anyone joining us who might be under 65 but newly qualifies for Medicare due to a disability. Your timeline works a bit differently. Your chance to join generally starts 21 months after you get Social Security or Railroad Retirement Board disability benefits. Actually, you'll get Medicare automatically after receiving those disability benefits for 24 months. Oh, and there's a really notable exception here. If you have ALS, which is also called Lou Gehrig's disease, you get Medicare automatically as soon as your disability benefits start.
All right, Section 3, the two main paths. What are you actually choosing?
It's a great question, isn't it? Because you aren't just signing a piece of paper for one monolithic government program that you blindly accept. No, you are actually selecting the entire framework for how you're going to receive your medical care moving forward. You're deciding how much flexibility you'll have to choose your doctors and exactly how much you're going to pay out of your own pocket when you get sick. I know, it can feel incredibly overwhelming, but we are in this together, and I promise it's completely manageable when we break it down.
To make these intimidating choices a bit more tangible, I want you to think of it as a choice between an a la carte menu at a restaurant and a bundled combo meal. On one side, we have Original Medicare. This is the traditional government-run system, which is made up of Part A for hospital insurance and Part B for medical insurance. We call it a la carte because you have to add on the other pieces yourself. Then on the other side, we have Medicare Advantage, which is also known as Part C. These are Medicare-approved plans offered by private insurance companies. They essentially take all those different separate parts and bundle them together into one alternative package.
Let's dig into that first option. Section 4, how Original Medicare works, the a la carte approach.
As we walk down this Original Medicare path, we absolutely have to talk about cost. The crucial point here is understanding a term called coinsurance. In Original Medicare, once you meet your yearly deductible, the government pays 80% of the Medicare-approved amount for your Part B medical services. You are responsible for the remaining 20%. That 20% is your coinsurance. And here is why that is so important to your wallet. In Original Medicare, there is no annual cap on that 20%. None. So if you have a major surgery or a long illness, that 20% can add up extremely fast.
But the massive trade-off for carrying that financial risk is total, absolute freedom. With Original Medicare, you can see any doctor or visit any hospital anywhere in the United States as long as they accept Medicare. You don't need a referral to see a specialist either. If you need to see a cardiologist 2 states over, you just go. However, keeping with our a la carte theme, Original Medicare does not cover most routine dental care, eye exams, or prescription drugs. If you want drug coverage, you must buy a separate Part D plan. And to help cover that open-ended 20% coinsurance we just talked about, many folks also buy supplemental coverage, which is commonly known as a Medigap policy.
Now for the alternative. Section 5. How Medicare Advantage works. The bundled approach. Let's explore that second path, which is really the private sector's response to that complex a la carte menu. Medicare Advantage, or Part C, is a Medicare-approved plan from a private health insurance company. So instead of you having to manage Part A for hospitals, Part B for doctors, and then go buy a separate Part D for drugs, the private company just bundles all of those together into a single plan for you. You still have Medicare, and you still have all the exact same rights, but you're getting your benefits managed through this private entity.
But, as you might guess, that convenience comes with some specific rules, particularly regarding exactly who you can see for your medical care. Medicare Advantage plans operate using provider networks. The 2 most common types you're going to run into are HMOs and PPOs. With an HMO, or Health Maintenance Organization, you generally must get your care and services from providers strictly within the plan's network, and you usually need a referral from your primary doctor just to see a specialist. Now, with a PPO, or Preferred Provider Organization, you get a bit more flexibility. You can go to out-of-network doctors, but if you do, it is going to cost you more out of your own pocket. The upside is that PPOs typically don't require referrals for specialists.
Beyond those network restrictions, there are a few other critical rules for Medicare Advantage you need to know. These plans often require what's called prior authorization, and I really want to emphasize this point because it's a huge factor in how you get your care. It means you or your doctor must get approval from the plan in advance before they'll agree to cover certain services, items, or drugs. If the plan says no, you might be on the hook for the full cost. They also use plan-directed care, steering you toward their preferred facilities. But, and this is a big but, the huge draw for these plans, and honestly why so many people choose them, is that they often include extra benefits that Original Medicare simply doesn't. Things like routine dental care, vision, and hearing services. Just keep in mind, the out-of-pocket costs, your copays and deductibles, they vary greatly from one plan to another.
Which brings us to Section 6, making your final choice. Which path is right for you?
When we place these 2 paths side by side, your decision really boils down to balancing flexibility against structure. Original Medicare gives you ultimate geographic and provider flexibility. You can see any doctor in the U.S. who takes Medicare for sure. But you face that standard 20% coinsurance without any cap, and you have to juggle a separate drug plan and probably a supplemental policy. Medicare Advantage, on the other hand, gives you a neatly bundled package. It often comes with those nice extra benefits like dental and vision, and crucially, they do cap your annual out-of-pocket expenses. But in exchange for that, you must navigate their network restrictions, get referrals, and deal with prior authorizations for major care.
So as you look at that calendar and count down the months in your initial enrollment window, I want to leave you with this question to really chew on. Which path gives you the peace of mind and the flexibility that you need for your healthcare future? Are you someone who travels all the time and wants to see any doctor anywhere? Or do you prefer the simplicity of an all-in-one package and you don't mind staying within a local network? The choice is entirely yours. But remember, the clock on that 7-month window is ticking. Take control of your options, weigh those trade-offs carefully, and make the choice that empowers your health for all the years to come.